Hello friends, myself Dr. Sachin Marda, Senior Cancer Specialist and Oncologist from Yashoda Hospital, Hyderabad. So August month, as we all know, we celebrate our Independence Day, 15th August, but also August month is celebrated to create awareness about cancer of appendix. We all know that appendix is a small organ in our intestine, near in the intestine, and many of us have been underwent some surgery, or our relatives underwent for surgery for appendicectomy. That is a normal infection, appendicitis and infection. But sometimes, very rarely, there could be appendix cancer also. So what the signs or symptoms of appendigeal cancer? It may be just pain or infection, or maybe diarrhea or vomiting. We do some test like CT scan or ultrasound or blood test to rule out the some other spread into the abdomen or into the body. And as all appendix tumor, first primary treatment is surgery. So we do either laparoscopic surgery or open surgery. And if the tumor is very small at the tip of appendix, only small surgery like appendicectomy is sufficient. But sometimes if the tumor is little advanced, it is going towards the colon, intestine, or there is some lymph nodes, then we need to do a colectomy, that is right hemicolectomy, removal of the part of the colon and intestines and nodes. Sometimes it may be little aggressive tumor which had spread into the abdomen and peritoneum. That time we might take help of the recent new technology like HIPEC surgery. HIPEC stand for hyperthermic intraperitoneal chemotherapy during the surgery only. So these all options are there. Some patients will require chemotherapy also. So friends, appendicitis is very common, but appendix carcinoma is very rare. But still, whenever we undergo surgery, we have to look for the final histopathology report, which comes after 3-4 days or 1 week of surgery, and just we need to pay attention that it is just an infection and not a cancer. So just follow that. Whenever you undergo any procedure for appendicectomy, just ask for your doctor about the final histopathology report, and if it is normal, no problem. If there is some doubt, please meet the oncologist. Thank you. For more updates, please like, share and subscribe.